perfect.
Okay, I'm going to keep you here while I ask like the, they're called OT questions. Okay, Dr. Chris Jones, when a player gets injured during a game, what's actually happening on your end in those first few minutes?
When a player gets hurt in a game, I am immediately rushing to the player if I think it is an injury that is emergent. And usually I will see that with direct visualization of the court. What will often happen, though, is I will stay back until the trainer signals that they need me. It's oftentimes that a player, 99% of the time, honestly, it's not an emergent situation, and the player is able to walk off on their own, and we go to the training room and we assess the player to determine if they can come back to the game. But it is a rare instance where I see something happen and I'm able to tell based on the mechanism of the injury that it's probably an acute injury that could be an emergent situation and need immediate medical care and decision making.
And then you rush. I heard you say that. It's
I rush.
Very dramatic.
Yes.
Okay, what's the most underrated thing that someone can do to protect their joints to stay active as they age?
I always say that there's a few things that are very simple. Number one, a healthy weight. So every extra pound we carry is about 7 pounds of force, just because of how the biomechanics work. 7 pounds of force on the knee. So cumulatively, over the course of a day, as we get out of this chair, get out of the car, climb up and down the stairs in the hospital, that is a lot of force across the knee. So if we're carrying an extra, let's just say 10 pounds of weight that we could stand to lose, and you lost that weight, that's 70 pounds of force over the course of a day that you are now taking off that knee and making that knee less likely to hurt over the course of a day. Number two would be strength training. We touched on this a little bit, but I think we're all really trapped in some of these sedentary jobs where we don't stay active to the point where when we do want to be active, our bodies aren't ready. And so I think it's super important to make sure that you are stretching, working on mobility, and however that is, is it just getting up in the morning and going through like a brief 10-minute stretch before you get going during your day, or is yoga your thing, right? Like sometimes people need to make it a little bit more formal and interesting. So whatever you're doing to stay mobile and keep your flexibility. And then number three, obviously, working with someone to ensure good mechanics. We all go through the situation where we're rushed through the day and we may not go pick up that box with great form and we throw out our back. And I think it's super important to realize, that everything we're doing throughout the day in terms of just physical activities, it should be done with good form and good function.
These are great recs. I mean, everyone always keeps telling us to do deadlifts.
Yeah, I have no problem with deadlifts if you're doing them at an appropriate weight and in good form. Yeah.
This is part of our osteoporosis conversation.
Oh, okay, yeah.
Okay, but everything else. Okay, great. I love it. Okay, between the Lakers, USA Basketball, and UCLA Bruins, goodness, you do a lot. Stop bragging. Are there any players whose work ethic or dedication to recovery has left a lasting impression on you?
Oh, man, there are so many athletes.
Besides yourself.
Yes. Being around these athletes makes me keep in shape. It really does. Being around that type of commitment and discipline to just, staying physically fit, it does provide a lot of inspiration. But at the collegiate and the pro level, and you've seen this now, it's just sort of the way sports is evolving. The commitment is kind of the same. You have these collegiate athletes getting this NIL money. They're almost professionals in their own right now, and a lot of them dedicate a significant amount of work behind the scenes to stay at the top of their game, to the point where you're comparing them to what you see at the professional level, and you're like, wow, this really is no different. There are a few athletes that come to mind. I mean, I remember taking care of a specific women's soccer player at UCLA. She ended up needing 2 ACL surgeries while she was with us. And then even after graduating from UCLA, going on to playing pro and needing 2 more subsequent surgeries. And I did a number of those for her, and just seeing her resolve and her commitment to the rehab process, it was just amazing. And I'll always remember. I mean, me and that particular player had a special relationship, which was great.
Yeah. So I mean, it's so much as mental fitness.
It is. Yeah. I mean, after getting to a certain point where I've done the surgery, sometimes, I feel like a little bit of a mental coach.
Yeah.
Mm-hmm.
It's fascinating.
Yeah.
And it makes tons of sense. Okay. As head physician, team physician of the Lakers, what's the most rewarding part of being in this particular role? Is it the big wins? Is it seeing players get back on the court after a long recovery? It's both.
Oh, it's all of it.
Yeah.
Yeah. I mean, I think playing such a large role in the medical care, so the diagnosis, the treatment, the prevention, all that stuff plays a huge role in a player's ability to get back on the court. And we take a lot of pride in making sure that we are accurate with everything we do. We are efficient with everything we do. We are providing players the best level of care to get back to a sport that has such high stakes. And then when that translates into wins and championships, you feel like you've played a big part in that. And I think, I have players who from our, championship team back in 2020 who have my personal cell phone and still call me with medical questions and text messages about, getting in to see me for certain things that they're dealing with now post-career. So, I mean, I think, it's great to have that type of relationship with them because it just shows that they trusted you.
Yeah, that's a real compliment. I mean, that's when care is like really actually caring about people.
Yeah.
Okay, one last one. What's one of the biggest lessons working with elite athletes that's taught you about the human body that you kind of didn't learn in medical school or even residency?
The amount of pathology that you can coexist with and has no bearing whatsoever sometimes on your ability or inability to perform a sport. It is not uncommon for us, again, to get MRIs of body parts, shoulder, elbow, knee in specific athletes, and see a partial rotator cuff tear, and then see them go back out there and throw a 100-mile-per-hour fastball. And that just informs me to know, guess what? My patient who wants to get back to swimming with a partial rotator cuff tear, they can also do that, right? It just takes the right commitment to physical therapy and all the other things that we talked about before, that low-hanging fruit that allows you to restore that function so that you can, again, learn to coexist with that pathology. So, I mean, it's made me not think with the scalpel all the time and think more about like my collaboration with physical therapists and the mental part of convincing a patient that, just because it's there doesn't necessarily mean that you need to have it fixed.
Amazing. I will let you go. It's phenomenal, the work that you do. I really, though, I can't help hearing like the themes that come up about just commitment and, collaboration and resolve and resilience. It's very, very cool. Thank you for doing everything that you do for UCLA Health, keeping our teams healthy, yourself, your biceps. Thanks for being here. It's been really awesome.
Thank you
so much, Chris.
Appreciate it.